Hi, let's talk about pelvic inflammatory diseases, or PID. PID refers to the infection and inflammation of the female reproductive organs, primarily the uterus, fallopian tubes, and ovaries. It's usually caused by bacteria, most commonly from sexually transmitted infections, such as Chlamydia trachomatis and Neisseria gonorrhea. These bacteria enter the reproductive organs through the cervix and can lead to inflammation, scarring, and damage if not treated promptly. Several risk factors could increase the individual's risk of developing pelvic inflammatory disease, and they include having multiple sexual partners, a history of previous sexually transmitted infections, recent insertion of an intrauterine contraceptive device, sexual activity at an early age, history of pelvic inflammatory disease, having unprotected sexual intercourse, douching, which can lead to disruption of the natural balance of the bacteria in the vagina. The symptoms of pelvic inflammatory disease can vary in severity and can include low abdominal pains and tenderness, unusual vaginal discharge such as yellow or green discharge with a strong odor, painful or frequent urination, pains during sexual intercourse, irregular menstrual blood flow, fever and chills, fatigue, and in very severe cases, nausea or vomiting. And if left untreated, pelvic inflammatory disease can lead to several complications, which includes a tubal ovarian abscess, which is a collection of pus within the fallopian tubes and ovaries, and this may require surgical drainage. Infertility could also occur, and they could result from scarring and damage to the fallopian tubes, which blocks the passage of eggs, making it difficult for the client to conceive. And the presence of ectopic pregnancy. Pelvic inflammatory disease increases the risk of fertilized eggs implanting outside the uterus, usually in the fallopian tubes. Also, clients could have complications such as inflammation and scarring, which can cause ongoing pelvic pains even after the infection is treated. To diagnose pelvic inflammatory disease, healthcare providers may use a combination of methods, and this includes taking a medical history. Here, the healthcare provider will ask about symptoms, sexual activity, previous infections, and contraceptive method used. A pelvic examination will be carried out to check for signs of tenderness, swelling, or abnormal discharge in the pelvic areas. Laboratory testings for STIs, such as Chlamydia and gonorrhea, may be performed through the use of a urine sample, cervical swab, or blood tests. In some cases, ultrasound scans or other imaging tests may be done to evaluate the reproductive organ and look for signs of complications. Prompt treatment is crucial to prevent complications of PID, and treatment usually involves the use of broad-spectrum antibiotics to target the bacteria causing the infection. It's important that the client completes the full course of antibiotics as directed, even if the symptoms improves. In severe cases, or if complications arise, hospitalization may be necessary for intravenous antibiotics and close monitoring. After treatment for pelvic inflammatory disease, follow-up care is essential to ensure complete recovery and prevent recurrence. Additional steps for prevention include partner treatment. It's crucial for sexual partners to be tested and treated for any sexually transmitted infections to prevent reinfection. Consistent and correct use of barrier contraceptive methods such as condom during sexual activity can also reduce the risks of sexually transmitted infections. Regular screening for sexually transmitted infections can detect infections early and facilitate prompt treatment. Ladies are also advised to avoid douching because douching can disrupt the natural balance of bacteria in the vagina, making it easier for infections to occur. Promptly seeking medical attention for any concerning symptoms, especially after potential exposure to sexually transmitted infections, can help prevent the spread of infections and reduce the risk of complications. Pelvic inflammatory disease is a serious infection that can lead to significant complications if left untreated. Recognizing the symptoms, seeking early medical attention, and completing the full course of antibiotics are crucial steps in managing the infection and preventing long-term sequelae. Practicing safe sex and taking preventive measures can reduce the risk of developing pelvic inflammatory disease and protecting one's reproductive health.